Colonoscopy is a safe screening procedure performed increasingly in Australia to detect and prevent bowel cancer. Those who should be offered a colonoscopy include those with a family history of bowel cancer, a personal history of previous polyps or cancer, anyone with a sudden change in bowel habit, a positive fecal blood test, rectal bleeding, iron deficiency anemia, abdominal pain, and unexplained weight loss. It's a safe procedure that can be performed in a day-stay hospital setting, and it involves the passage of a fibre optic camera through the colon, allowing visualization of the inside appearance of the colon on the bedside digital monitor. Colonoscopy is quick, safe and painless, performed under sedation, administered by a fully qualified anaesthetist. Once asleep, the colonoscope is inserted via the anus and rectum into the large bowel, also called the colon. The colonoscope is carefully manoeuvred around the curves present in the colon, with care taken to avoid trauma or accidental perforation of the colon. This is an extremely uncommon complication, occurring in less than 1 in 1,000 cases. The benefit of colonoscopy over other diagnostic methods is the ability to see real-time the appearance of the lining of the colon, looking for any abnormalities such as polyps or cancer, whilst also allowing for the therapeutic procedure such as biopsy or removal of any suspicious cancers or polyps within the colon. A trained colorectal surgeon will ensure that a complete colonoscopy is performed with passage of the colonoscope all the way to the cecum, which is where the large bowel and the small bowel meet. Cancerous lesions are biopsied, bleeding ulcers can be cauterized, and pedunculated polyps can be removed using snares. These are all painless and very safe procedures that do not involve surgery and can be performed as a day-stay procedure. Even very large flat polyps can now be removed at colonoscopy without the need for surgery, simply by injecting them with a fluid via a needle passed down the working port of the colonoscope. This lifts the polyp up so that they are no longer flat. This then elevates the polyp sufficient to allow an electrocautery snare or lasso to be placed over the polyp and closed, cutting the polyp with electrocautery from the underlying bowel wall, whilst also ensuring that the underlying deeper layers of the bowel wall are not damaged. Once this is done, the polyp can then be removed via a basket, which is also passed down the working port of the colonoscope. This allows for retrieval of the polyp and for examination of the polyp under a microscope to determine if there is any invasive cancer present or any high-risk factors that may warrant further investigation. Preparing for your colonoscopy. In the first 24 hours prior to your colonoscopy, you must fast, avoiding all solids. This includes fruit and vegetables or solid food of any kind. You can only drink clear fluids, which is any fluid placed within a clear container that is semi-translucent. Examples include water, apple juice, lemonade, strained chicken broth, and sports drinks such as Gatorade or Lucozade are excellent options, as these drinks contain the sugar and electrolytes necessary to prevent dehydration. A 3-part powerful laxative called PicoPrep will also be given to you. Each sachet is mixed with 150 ml of water and stirred for 30 seconds, then drunk over a minute or two. For morning procedures, the first PicoPrep is taken at 2 p.m. the day before your procedure. The second PicoPrep is taken at 4 p.m. the day before your procedure. And the third PicoPrep is taken at 6 p.m. the day before your procedure. For afternoon procedures, the first PicoPrep is taken at 6 p.m. the day before your procedure. The second PicoPrep is taken at 8 p.m. the day before your procedure. And the third PicoPrep is taken at 6 a.m. the day of your procedure, fasting from 7 a.m. It is important to drink plenty of fluid between each PicoPrep to stimulate bowel movements and cleansing of the colon. Half to 1 litre of fluid between each PicoPrep is recommended. The more you drink, the cleaner your bowel prep and the less likelihood of missing a small polyp or cancer. It is normal to expect some slight abdominal bloating and crampy discomfort from the PicoPrep prior to it taking effect, and it is important when it does take effect that you are at home or close to a bathroom. The morning before your procedure, you will receive a phone call to instruct you as to the procedure time. Last liquids should be 6 hours before your colonoscopy. Take your morning medications with a sip of water and present 1 hour prior to your planned procedure. Discharge is usually 3 to 4 hours after your procedure. Instruct your admitting nurse if there is any brown discoloration to your stool, as you will require a fleet enema to ensure thorough cleansing of your colon. You will meet your surgeon and anaesthetist before being sedated for your procedure. You should not feel pain or remember anything related to your procedure. During your procedure, you will be closely monitored by your anaesthetist and anaesthetic nurse. And after your procedure, you will be allowed to recover from the effects of general anaesthetic in the recovery unit, where you will be monitored closely by medical and nursing staff. Lightheadedness, nausea, and abdominal bloating with some crampy abdominal pain are all common side effects of the anaesthesia and colonoscopy and wear off very quickly. After your procedure, you must have a family member or friend available to drive you home, as you are not safe to drive home or operate machinery after anaesthetic sedation. Your surgeon will discuss the findings immediately after your procedure. 1 week after your procedure, you will be called if biopsies show cancer. You can also call your GP or ring 1300 265 666 to obtain a copy of your biopsy results. If polyps are found, you will be given a reminder phone call to repeat your colonoscopy every 3 years. Your colonoscopy can be performed in any of 6 hospitals, including both private and public hospitals. If in a private hospital, you can book online by visiting colorectalsurgeonsydney.com.au or by calling 1300 colonoscopy.